Dr. Vine, it would appear that you perform many challenging procedures at your office.
A day in and day out.
Well, let's take a look at another one.
Here's a gentleman who presented with a fractured amalgam restoration.
Amalgam restoration, that would be a silver filling, right?
Right. Yes, his treatment involved removing the fractured restoration and recurrent decay, as showed in the intermediate photo. The final restoration was achieved using a bonded composite material. This is an interesting case because with the amount of tooth structure needing to be restored, a more durable restoration would have been a full crown. Well, this would have involved more cost and time for the patient. However, ultimately, it might have been the therapy of choice. And Deborah, in a situation like this, if you are going to perform a crown restoration, you have to stop your procedure and take an impression and send it to a lab, and you have to send it to a good lab. So that takes time and money, and the difference between doing that and the direct restorations is the composited plate is placed at that appointment.
So it sounds like sometimes you have more than one way to solve a patient's condition.
Many times, and carefully evaluating each and every patient is critical to achieving an outcome that is tailored specifically for them.
Well, that's very important. Well, while we're on this subject, what's the story with the silver fillings and toxic metals like mercury? We've heard so much about that.
Silver fillings are really what's referred to as an alloy, or a combination of metals, including minute quantities of mercury. Well, the controversy exists regarding the toxic nature of mercury. However, according to the American Dental Association, no evidence of this has ever been determined.
So how does a patient know what to do about these fillings?
I've included information about this subject in my book, Understanding First-Class Dental Care, where patients can call my office anytime.
Great. Well, I know we'll be getting a lot of questions, so let's put up the numbers on the screen. And when's the best time for patients to call you, doctor?
Well, during the week, they can call in 305-538-1115, and if they have an emergency, they can call on my emergency line.
Well, I know in today's economy, people want to know how much their dental care will cost them.
Yes, I understand. We offer new patients a free consultation.
Free?
Yes, and we can usually predict very accurately the amount of work they will require and give them an accurate estimate.
Well, now I know we'll be getting a lot of calls, so let's put that number up again. My guest today is Dr. David Vine, renowned Miami Beach dentist and the author of the book Understanding First-Class Dental Care.